Acupuncture and myofascial lines, the 7 tigers. Here we see the 7 tigers, and they're an interesting group of points because they're located in the UB58 to UB60 region. They're also associated with the superficial back line, and more specifically, the soleus muscle, which we see here. So this superficial back line, it looks a lot like the bladder meridian, but remember that there's this Tai-Yang relationship. Here we can see the precise anatomy that exists between these two channels. Here we see the 7 tigers again, and let's take a more detailed look from a course excerpt. In this section, we'll be speaking about urinary bladder meridian points for shoulder pain, as well as one of the kidney points that's used in the Master Tung system. So this area from UB58 to UB60 is a really interesting area. And in the Master Tung system, we use a group of points called the 7 tigers. Now, the way that you find these is you come up 2 sun from UB60 to get to the first point, and then come up another 2 sun to get to the second point, and then 6 sun above UB60 is that last point. So when you needle these 3 points together, that's referred to as the 7 tigers, and these are traditionally indicated for pain in the scapular area. Now, before we move on, I want to talk about what's known as the scapulothoracic joint. So you can use these points for many pain patterns that exist within the scapula as traditionally indicated, but then also problems of the scapulothoracic joint. Now, this isn't a true joint in the way that bones come together and form joints. However, it is referred to as a joint in anatomy and in the other Western medical sciences. So to begin our discussion with this joint and looking at how these points work, we need to be familiar with some of the muscles that are involved in the mobility of the scapula and the ST joint. Okay, so the trapezius plays a role in the ST joint. The rhomboids do as well, levator scapulae, the lats, the serratus anterior, and the pectoralis minor. So some of you may know this group of points for treating pain at GB21, and GB21 is located right at the top of the trapezius. And so we see then that when we use these points for treating pain at GB21, it's affecting the trapezius and very likely this ST joint as well, because we do find it indicated traditionally for pain in the scapula and then also in this area. Now, in the traditional practices, we think of this as the Tai-Yang connection. So here we see an image of the superficial back line, which these points are technically located on. And then if we look at the small intestine meridian or this deep back arm line, we find that the rhomboids and then the subscapularis and then levator scapulae is on the small intestine meridian or the deep back arm line. So some of these muscles then that are part of the ST joint, such as the rhomboids and the levator, these are on the deep back arm line or the small intestine meridian. So just to make this really easy, this is that Tai-Yang relationship between the small intestine and the bladder. Okay, so we can use these points on the urinary bladder meridian to treat pain in the small intestine meridian in this region. Now, as we come to greater understand the anatomy and how it relates to these, then we can start to refine the use of our points and use them in a more targeted way when we understand these muscles that are part of this ST joint. Okay, so I've used these points successfully on a lot of people for treating pain at GB21, okay, on the trapezius. I've used them for pain in the upper back area. These aren't necessarily my first choice points for pain in the upper back, because one thing that you need to distinguish here is if the pain is in the erector spinae, then I would be more inclined to use UB57 and points either just proximal or distal to that. That's a great treatment that Dr. Tung taught for treating upper back pain. It works really well in a lot of cases, but not in all of them. So I do like these points for some cases of upper back pain, but it helps to understand how these different point groups work and understand the anatomy behind it so that you can get better at your point selections. Okay, so the rhomboids then are located between the scapula and the thoracic spine, and we see them here. So you can use them for pain in the rhomboids as well. But the point I want to make here is that if you do the 7 tigers for pain between the shoulder blades and the patient doesn't respond, then a lot of times it'll be best to use these points here and consider them to be affecting the erector spinae, whereas these points, the 7 tigers, they tend to have more of an effect on the small intestine meridian and the levator and these muscles that are involved in the ST joint. So I know that was a lot of words, and I want to try to clear things up here because it's not always easy to determine when these points will work better than some of the other choices that we have. But what I want to make clear and what I've found in my practice is that if the ST joint is involved and these muscles of the ST joint are involved, especially the traps or the rhomboids or the levator scapulae, those 3 muscles will respond well to these points, okay? Now, the pectoralis minor is also involved in the ST joint, but remember that that is part of the lung meridian and that deep front arm line. So if it's an ST joint condition and they have pain in the anterior shoulder at the coracoid process, like we spoke about before, then you got to pair these points with a point like shao to address conditions of the ST joint. Okay, now that's a very Western way to explain it and a very anatomical way to explain it, but the more that you understand this, then the better results that you're going to get. And similarly, if you have a client and you treat them for upper back pain, and let's say that you do these points from UB57 and just down, straight down the line near there, or you use UB57 with a point that's Tucson proximal and Tucson distal, and you don't get a result with treating upper back pain, then you've narrowed down your selection. You can look at using the 7 tigers, and I would use those if the scapula is involved. You could also potentially use small intestine points or even the lung points, okay? So get used to isolating your points, as we've spoke about, by just using 2 or 3 groups to begin with, and that would involve just 3 to 6 needles, and then having the client move. And then if you don't get a result with these, then you're going to want to consider what other fascial lines you should be using.